Just about 12:50. You know what happens every day of the week, just about this time. We talk to a wonderful doctor associated with Altus. It's the Altus Medical Health Update of the week. This week, I like this one. I like them every single week, but this one, you know what? I've always thought there's something wrong with me neurologically. We're going to get to the bottom of this. Dr. Shahin Shirzadi, advances in neurological disorders, obviously associated with Altus. How are you, doctor? Appreciate you joining us for a few minutes.
I'm doing well. Thank you so much.
You are a board certified. It sounds very official, by the way. A board certified neurologist. So you see patients with a wide variety of neurological problems. What are some of the conditions that you treat in your practice?
Well, in our practice, we see a wide variety of conditions, anywhere from stroke, Alzheimer's, Parkinson's, multiple sclerosis, migraine, epilepsy, spinal cord problems, muscle disorders, or any kind of nerve problems.
Hey, that's a lot. And is this something that we see regularly? I mean, you've been in practice for quite a while. Has this been more common now? Do people now think they really have an issue and they're more apt to call you if they have some issues like that?
It is. We're catching diseases at much earlier stages, so we're seeing a lot more patients, especially in the field of Alzheimer's, Parkinson's. We're catching diseases at the very early stages.
Migraine headaches, migraines. You hear people say, oh, my goodness, I have a headache and I need to take some aspirin. But I know people specifically, some buddies of mine, who are absolutely been diagnosed with migraines, and it really can get these guys down. I mean, they have to lie down, and there goes a few hours of their day. Some of them are on prescription inhalers, whatever. It's a very huge issue for a lot of Houstonians. Are there any advancements in the treatment of migraines?
There really has been. Just a little bit of a background information for you. Over 30 million people in the U.S. are affected by this condition, so it is really common. Now, the estimated productivity losses from migraine that will cost American employers every year, it's about $13 billion. So there's been a lot of advances in this field in order to prevent such a huge expense. Now, the treatment of migraine is divided into two sections. One is acute treatment. What that means is that when you get the headache, you want to take something, get rid of the headache, and move on with your life instead of having to be down for 24, 48 hours. So there's a lot of different medications that have been introduced into the market, and they're highly effective. And, again, the advantage is it doesn't cause any drowsiness and allows you to go on with your life. Now, in patients that are having very frequent headaches, meaning they're having headaches every week, or a couple of times a month, we recommend preventative medications. Now, these are medications you have to take on a daily basis, no matter if you have headaches or not, in order to prevent the headache from happening. Or if you do get a headache, hopefully it won't be as bad and intense. There's a lot of different medications we use for that. In the last few years, Botox, however, was introduced into the market and FDA approved for treatment of chronic migraine headaches. Now, Botox is not for everyone, and when you hear Botox, everybody starts thinking about cosmetic injections and getting rid of their wrinkles. However, Botox was introduced into the market in 1991 for treatment of neurological problems, mostly muscle spasticity, meaning that the muscles are very tense as a result of a stroke, motor vehicle accidents resulting in trauma or injury to the head. And so we've been using it for neurological problems for many years, but it's only been a few years that we've been using it for Botox. It's highly effective, but it's not for everybody. You have to have certain criteria met before you give Botox.
So if you go that way, not only is your migraine going to clear up, you're going to look 10 years younger. Hey, that's a twofer. I like that. Dr. Shahin Shirzadi joining me here at the Altus Health Update every Wednesday right about this time on my show, Advances in Neurological Disorders. I want to talk about some disorders like Parkinson's and Alzheimer's diseases. As we live longer, we're hearing so much about an increasing number of people being diagnosed with these conditions. Any new treatments regarding these specific diseases?
Absolutely. As you mentioned, age plays a big risk factor for development of these conditions. Let's start with Alzheimer's. Alzheimer's, when you're 65 years old, your risk of developing Alzheimer's is about 2%. And that doubles every 5 years. So by the time you get to be about 85 years old, your risk of developing Alzheimer's is about 32 to 35%. So it's pretty high chances of developing Alzheimer's. So there's a lot of research going on as far as what can we do to prevent Alzheimer's or maybe even postpone the onset of symptoms. So they've looked at a lot of different things. They've looked at vitamins, maybe vitamin E, vitamin C, CoQ10. They've looked at hormones. They've looked at anti-inflammatory medications, anti-cholesterol medications. none of them have panned out to be effective. The only two things that have shown to be helpful in prevention of Alzheimer's seems to be exercise and be a vegetarian. Now, in the last 15 years, they've come out with 4 drugs. Now, these drugs, what they do is they slow down the progression of the disease, but unfortunately don't reverse it or even stop it at that stage. So we still got a long way to go with Alzheimer's. Now, with Parkinson's, it's a different story. Parkinson also, age plays a huge risk factor, but the highest age group that you see Parkinson's disease is between the ages of 60 and 65. Now, in the last 15 years, we've had over 10 drugs that have come out that are highly effective for treatment of Parkinson's disease. In addition to that, there is a surgery by the name of deep brain stimulator, where there's these wires that are placed on each side of the brain and then attached to a device in your chest area, and it gets programmed every 6 to 8 weeks. It is an amazing sight to see when the machine is programmed and how these patients do. Now, again, just like Botox, it's not for everybody, but if you select the right patient, it is an amazing sight.
Making notes right now. Eat your vegetables. Broccoli and carrots are now on my list, along with exercise. It's a great, I did not know that about Alzheimer's. Great, great fact. Dr. Shahin Shirzadi joining me here for another minute or two. What is something that most people don't know about neurological conditions that they probably should know?
Well, the neurology, for the longest time, there were not that many drugs that we could treat patients. But in the last 15 years, we've had so many drugs that have hit the market and are effective drugs for different conditions. And every day, new drugs are coming out, new treatment options are coming out. So patients that have neurological problems, if there is no treatment for it now, keep following with your neurologist, because in the very near future, hopefully, there will be a drug that will hopefully treat your unfortunate condition.
Tell us about your clinic locations, if you can, doctor. I know you have a couple of offices in the Houston area.
We do. We have one location is in Houston. It's on 7500 Beach Nut. And we have one location in Sugar Land, which is 1415 Highway 6. So we have 2 locations at this time. We also have a website, www.hnamd.com.
hnamd.com. Real quick, throw out the phone number if anybody wants to give you a call.
Sure, it's 713-777-4122.
777-4122. Obviously, all this information, like it is each week on the Altus Health Update Minute, we're going to put it on my website blog at the950.com. Dr. Shahin Shirzadi, there's your tip. Maybe potentially Botox so I can look good, stop the migraines, and I'm going to eat my vegetables right now. There's my tip of the day, thanks to you, sir.
Sounds good. Sounds good.
Appreciate your time, Noe. Thank you for calling in.
Thank you so much.
All right, we're top of the hour.